You're probably seeing the signs of low iron every time you look in the mirror and you don't even know it. Today, I'm breaking down exactly what low iron looks like on your face, why it happens, and most importantly, how to fix it naturally. Let's get into it. Iron is an important mineral for oxygen delivery. When your iron is low, specifically when your ferritin drops, your body has to start rationing oxygen to your tissues. Your skin, hair, and nails are not essential organs. So your body actually starts pulling resources away from them to protect your heart, brain, and muscles. That's why your face is often the first place where low iron shows up. What you're seeing isn't just a cosmetic issue. It's your body waving a red flag that something is wrong internally. The first common sign of low iron that shows up on your face is pale or washed out skin. It's often missed, especially in women of color, because you may not look ghostly pale, but you may notice your natural glow or undertone feels off, giving your skin like a grayish appearance or flat appearance. That's because with less hemoglobin, which hemoglobin is an iron-rich protein in red blood cells that carries oxygen from the lungs to the rest of the body. So with less hemoglobin, there's less oxygenated blood reaching the surface capillaries under your skin. So this causes you to look pale. The next common facial sign is hollowing or dark circles under the eyes. This is a common one that I hear women complain about. When your iron is low, you get thinner skin and weaker connective tissues around the delicate under eye area. This area right here can be very thin, very sensitive. This makes the underlying blood vessels more visible, creating that sunken, tired look. So no matter how much rest you get, you can wake up and still look tired and exhausted because the under eye area looks sunken and dark. One study actually showed that the chronic iron deficiency is a contributing factor to periorbital hyperpigmentation, which is basically darkening around the eyes. The next common sign of iron deficiency is cracked or pale lips. Your lips may lose their natural rosiness and appear more pale or even bluish, and that's due to the lack of oxygen. Some women also experience what's called angular cheilitis, which is cracks at the corner of the mouth, which is often a combination of low iron, low B12, or low vitamin B2. This is why checking your labs is very important. Now, the next common sign that you can notice on the face is eyebrows and eyelashes looking very brittle. So this one often gets overlooked, but iron is very important in keratin production. Your brows may thin out and your lashes can also become sparse and break easily. This is also noticeable if you used to have thicker eyebrows and then you now notice them that they're getting thinner. The next common sign is shedding and thinning around the hairline, the temple area specifically. So iron deficiency is actually one of the most common causes of hair shedding in women. And it's not just about your scalp. Most women first notice whitening at their hair part, temples, or edges. A study published by the Skin Appendage Disorders in 2017 directly linked low ferritin to increased hair shedding in women, even when the hemoglobin was normal. So that means that they did a basic complete blood count, which is a CBC, that shows the hemoglobin levels. And the hemoglobin levels were fine, but with further digging with a complete iron panel, it was found that the ferritin levels were below optimal levels, which would be less than 50. Now, the next sign that shows up on your face is facial puffiness or inflammation. This actually might surprise you, but iron plays a role in regulating inflammation. Low iron can indirectly increase systemic inflammation, leading to mild puffiness, especially around the eyes and the lower part of your face. So why are these things often missed, even when you have your regular routine appointment, your labs have been checked, and you've been told that everything is fine? That's because for the most part, the labs that are usually ran only check for hemoglobin, which can be a late stage marker, meaning that your ferritin, which is your iron storage protein, can actually drop way before your hemoglobin does. So many functional practitioners would consider ferritin under 50 as suboptimal for women, even though the lab reference often says that normal starts as low as 10 to 15. Keep in mind, if you're pregnant, you suffer from postpartum, you have heavy periods, or you're on a plant-based diet, you're at much higher risk, even if your CBC looks normal. So how do you fix it naturally? The first step is getting the right labs done. So you want to ask for a full iron panel, which consists of ferritin levels, serum iron levels, total iron binding capacity, and percentage of saturation. And I will discuss in another video understanding your lab values and what they need. The next thing that you want to do to fix this naturally is prioritize bioavailable foods, meaning you want to eat the foods that have high quantity irons and have the highest rate of absorption. So let's talk food, because the internet loves throwing spinach at you. Spinach is not the only thing that can raise your iron, let's be honest. But you do have to keep in mind that there are two types of iron. There's heme iron and there's also non-heme iron. Heme iron is typically best absorbed and it can be found in animal products such as grass-fed beef, lamb, bison, chicken liver, and some meat, some seafood. Non-heme iron is most commonly found in plants and legumes such as lentils, pumpkin seeds, and blackstrap molasses. So the key here is to pair each of the iron groups with vitamin C so that you can increase the absorption rate. The next thing that you want to do is to use gentle supplementation. Now, if food isn't enough and you need a little bit of a boost, I understand. Some women just don't get enough iron even when they do all the right things with eating iron-rich food. You want to look for supplements that won't give you harsh side effects so that you can be consistent, right? Who wants to take supplements and the supplements make them feel worse than they're already feeling? That kind of defeats the purpose and it lowers the rate of consistency. Iron bisglycinate is highly absorbable and also gentle on the stomach. You can start as low as 15 to 30 milligrams of iron every other day, and you want to retest ideally between 8 to 12 weeks. You also want to make sure you check additional nutrients. B12, folate, copper, and vitamin A can all impair iron metabolism. That's why testing is so important. You want to make sure that you currently don't have any of these deficiencies so that you're not just blindly supplementing and not looking for the root cause. Now, if you found this video helpful, make sure you like and subscribe. If you want my free iron recovery cheat sheet, I'll drop it in the links down below. See you next time.